My name's Simon Clark. I'm the manager of an early intervention team and I'm a care coordinator.
I'm Victoria. I'm a social worker and a care coordinator.
My name's Jonathan West, Dr. Jonathan West, and I'm a consultant psychiatrist.
My name is Angelica and I'm a clinical psychologist.
My name's Zach, I'm a community psychiatric nurse.
My name's Kat and I'm a employment specialist.
My name's Mayowa and I'm a clinical psychologist.
An EI service is a specialised community mental health team that helps people and their families recover from a first episode of psychosis.
Well, they can expect to have a care coordinator, so somebody who'll probably see them weekly and kind of check in with them and kind of make sure that things are going okay for them. They'll expect to see a psychiatrist, so somebody who kind of manages their medication and make sure that the medication they're taking is helping them to kind of manage their symptoms. They can expect to see a psychologist, so somebody like me who would probably work within a therapy called cognitive behavioral therapy, which helps people to make sense of their thoughts, their feelings, their emotions and their actions.
So the early bit of the treatment is often about getting somebody on the right medication, sort of stabilising their mental state. Then the middle bit is perhaps more about social inclusion, getting them back to college, back to university, offering them therapy, so meeting up with a psychologist. And then that final bit of the sort of 2 or 3 years is getting them prepared for discharge, so learning how they can survive when we're not there anymore and making sure that they've got links within the community.
Sometimes we can help go back to college, go back to education or employment, but even if they just want to help get out there and make friends, or we can go to the gym and do a bit of exercise. We've got football groups, we've got hearing beliefs groups, which helps people talk about their psychosis, and we just try and get people out there.
As care coordinators, we accompany patients to meetings. We empower them to take back control. We advocate on their behalf. Due to the nature of some individuals' mental illness, they're unable to make informed decisions and choices when they're unwell. So we ensure that they are supported through their decision-making process, that they are not marginalized because of their illness.
We also provide family intervention, which is a really important part of our job because psychosis doesn't just affect the individual, but it affects the whole family as well. So we might meet up with families, which gives them a chance to talk about psychosis, to talk to each other, and find ways of working through difficulties together.
There is light at the end of the tunnel.
I've seen people go through psychosis and gone on to have really successful careers.
Yes, there is life after psychosis. So people go back to work, they go back to their families, they go back to school, they go back to living the lives that they had before. And sometimes they go back to living better lives than they had before.